Morning, everybody. I'd like to call to order on Wednesday, August 20th, the public health meeting. And please call the roll.
Arroyo. Tui. Be here. Genesis. Tarver.
Tarver's here remotely.
Young. See that he is online.
He's muted.
Sanchez.
Sanchez present.
Strathman.
Strathman here.
And Roth.
Roth is here.
Okay, thank you. I'm Cheryl Strathman, Chair, which I forgot to say earlier. And I would like to start by saying today is National Bacon Day.
Bacon.
National Bacon Day, which is actually, you know, the duct tape. I should have, right? It's the duct tape of the kitchen, you know, that's his.
Dad's birthday. He would have been 105.
Oh, wow.
Oh, wow. Well, happy birthday to your dad. It's heavenly birthday, so. Okay, we have a remote attendance request from Bill Tarver. Do we have any objections? Okay, thank you. Welcome, Bill. And I'd like to ask for unanimous for approval of the minutes.
Sanchez will ask for unanimous consent to approve the minutes of July 16th, 2025.
Thank you.
No problem with that.
Okay, and now we have, we're going to proceed to public comment, and we have Lori Powell this morning. Good morning.
Good morning. I'm Lori Powell. I've been here in Kane County for 23 years. So this is my third request for equal access to religious exemption form on the Kane County Health Department website. So at the start of 2025, the Kane County Public Health Department added a link to the VAERS, Vaccine Adverse Event Reporting System, after many months of public requests. This was an important step towards transparency, helping residents access information about potential adverse reactions to vaccines. However, genuine informed consent is still incomplete without equal access to all legally recognized options. So once again, this is my third formal request that the health department puts the immunizations link to the Illinois Certificate of Religious Exemption. Currently, it's on the IDPH's website, but is not on Kane County's. There is the State of Illinois Certificate of Health Examination form, but I think it still would be important to have the religious exemption form there as well. So I did send an email to everybody on this board, and I included that link on IDPH's website, and I explained that if you just scroll down to under forms, you can see the direct link to the PDF. And then I also included another link besides the website to the actual PDF. So this form alongside the health certificate ensures that all parents are aware of their rights and can easily access the documentation required under state law. Parents shouldn't have to search for this form when another state required form is prominently posted. Presenting both documents side by side is a reasonable, balanced, and urgent step toward true informed consent for all families in Kane County. I respectfully request that this link be added to the Kane County Department's immunizations page without further delay. Thank you for your attention for this matter and your commitment to serving our residents.
Thank you. Okay, that is all for public speaking this morning. So the reports are on file if anybody has any questions. Okay, then first up we have Mr. Brett Youngstead. And I want to say this morning that as I was getting ready for today's meeting, I noticed on our committee goals that we have not included animal control. I think we had at some point, and then something got in the way. I'm not sure what, life maybe. And I am asking Mr. Brett Youngstead to help us with that so that next month we can add a committee goal that includes animal control. Because you're a big part of our approach for public health here in the county.
Thank you.
So.
And I will make sure to have something ready for you for the next one.
Great, great. So what do you have for us this morning?
All of my monthly numbers are currently, sorry. Thank you, Blair. are currently in the packet. If anybody has questions, I'm always available for those. Just a reminder that this Saturday is our first clinic back, August 23rd from 10 a.m. to 1 p.m. It's our low-cost rabies and microchip clinic. We always encourage everyone to come out. We will still have 2 more after this, Wednesday, September 17th and Saturday, October 18th, if you miss this weekend. But if anybody would like to even come, just check it out, please do. That's all the information I had for this month. Then I have my budget presentation. Perfect.
So before Brett presents his budget this morning, and Michael will be presenting his as well, I just want to remind the committee that they are not part of the general fund for their budget. So as we listen to what they have to present to us, we need to remember that it's their job, and they have done an excellent job of not only preparing to share with us today, but also with managing their departments and their monies. So with that, Brett, take it away.
Thank you. This is a breakdown of our full organizational chart. We are 15 members, have been 15 members since I started, and we have not changed or increased in any way throughout that time. The only thing that occurred was our county veterinarian was a contractual employee. The DEA changed some of the requirements with the handling of controlled substances, so that position became a part-time position brought on board. So that is a position count position now and not contractual. Real quick, I did send out this presentation. Everybody, apologize. One of the questions I got back was revenue and tag fee questions. So I wanted to make sure that I broke it down a little bit just so everybody could be on the same page and understand. The Kane County fiscal years are December 1st and November 30th. Tag fees are done per year because they're done for 2024, 2025, 2026. They're done for full calendar years. So January 1st to December 31st. What this means is, so if we come to you with a tag fee increase, that increase does not affect any of the tags that come in throughout all of December or given throughout December. It wouldn't take effect till January 1st. Other issues we currently have is there's no ordinance or law for how fast the vets send us their certificates or the money with those certificates, only that they must send us the certificates of animals that are vaccinated within Kane County. Just like we send to other counties also send to us. So we always make sure that the counties are where you're supposed to register have the current information. That being said, we are with some groups months behind receiving their fiscal tags. So sometimes when a new tag fee takes effect, we won't even start to see those funds for 6 to 8 months into the year, sometimes not for the second year. Due to this, it takes an average of 2 to 3 years to really show our revenue. So when we do a tag fee for the next 3 fiscal years, we're calculating what the revenue increase is really going to be. And this is due to the fluctuation of the 3-year cycle for people that receive tags every 3 years. This is the state law that everyone must receive a 1 year before receiving that 3-year. Lots of new puppies, new people coming in, animals that pass, new animals becoming parts of families. Also, the fluctuations with economy has become really tight, hence the reason we do our low-cost clinic to help people ensure that they are vaccinated and registered, because that is a law. What am I? Perfect. So as we look at our expenses and revenues over the last 5 years, we do see that the trend has been increased, but our expenses has been a very steady increase, not a drastic increase at all. And that is just due to cost of living, electric going up, gas going up, and we did calculate for that this year, especially with our new generator on board. We know that our NICOR expectation is going to be a lot more, so we put another $1,000 into there just to ensure, because the first year we don't know. We're testing the generator. It's now online. It's had to work twice over the last 2 days, which is fantastic. Great test of it. In the shelter stayed up, powered. Animal didn't lose anything with all the high humidity, which was fantastic. Looking at our revenue for 2026, there is a slight increase that I talked about from 2025 to 2026. That is about a $72,000 change. The other thing I want people to notice is something we talked about. We had a lot of money in reimbursements. We found it very difficult to fully track what was occurring with the municipalities. It's a charge for service at these municipalities. It's not a reimbursement. So we have emptied out the reimbursement line because we feel that, one, that was very misleading. Two, we weren't able to fully track all the individual services we actually do for the community. So everything was brought into charge of service, which is why our charge for service revenue is a lot higher. That charge for service is also the tags, which is why about 96 to 98% of our revenue is those tags. That's how we receive our funding. The other 2 to 4% is from our miscellaneous services that we provide with adoption, rescue, a return to owners, and other services in that. Perfect reimbursement charge services.
Do you want to take questions during?
Oh,
or
I
would
don't
you-
mind.
Okay,
Or I can wait till the end.
let's wait till the end, Bill, if you don't mind.
I'm fine.
The expense report? Oh, not a problem. Please let me know what you guys want.
Just write it so you don't forget.
The expense report, the biggest increase you're going to see is twofold. One is going to be in contractual services, in actually commodities, excuse me, I was looking at the wrong line. And that's again, Nicor, all of our gas, electric services like that, we know are on the increase. Yes, we do have the solar panels. Solar panels account for about 75 to 80% of our electricity. We still pay the other percentage through Geneva, and those rates are constantly going up, as the bills here have seen. The other big one this year is our capital. We have put off our vehicle as long as possible. Our first vehicle that's up for being replaced is actually approaching 9 years. And already in the last month, it's quitting on us. It's been into the service station twice. We put out a little over $4,000 to keep it on the road because we do need all 4 of our vehicles on the road at all times. So that vehicle is starting to give up, which understandable. We did get it to 9 years. We're very excited. We pushed those years of life because I know average is about 4 to 5. So we're excited to finally get that to change over. Like I said, personnel has not turned over year to year. That has remained consistent throughout my 12 years here. Animal control does continue to focus on timely collection of its fees to ensure our financial stability. And we also ensure that we have one of the lowest tags in the collar counties. We do strive to keep those middle to low. We don't want to be the highest. We want to make sure that it is affordable for everybody here in the county. And there's the picture of our new generator, which we're very excited about. Please let me know if you have any questions.
Yes, Mr. Roth?
Roth here. You had mentioned there's a delay in getting from the cities and also the 3-year tag and the veterans. Do you track that in accounts receivable? Just, because there may be a lag, and we may see at the summary level, oh, your revenue's down, but it could be caused by that.
Yeah, my financial person, Rita Franco, keeps an amazing track
Okay.
on who owes us money, what tags are out there. Yeah, that's all done. And thankfully, our Chameleon computer system does it for us.
Right.
So as long as you're properly inputting everything, we're able to fully track where everything is at all
And,
times.
and I don't think we need to get in the weeds at the board, but if it becomes a large amount, that's when you want to say, hey, it's a 5%, or when it gets above a certain percent, just to give us a heads up. to keep-
No, we've thankfully only had to bring in the state's attorney once for one that
Okay.
was very out
Okay.
due, and it got corrected very
Okay.
fast. So
Good
we're
enough.
very thankful for that
All right.
department,
Thank you.
of course.
I do have a question. When you said that there's no regulation sending the certificates back from the vets or the money back from the vets, do we need something for that? And would that be at the state level?
It would be at the state level because the state is the one who regulates and says that it must be sent to your local animal control. It's a matter of just timing sometimes. A lot of these businesses have gone corporate. So they have to send the bill to corporate, then corporate has to issue the check. The check has to then be mailed to us. So it's a lot of tracking for my department, but thankfully use of technology has been our friend to help us keep on top of that.
So it's a nuisance, but that's what it is.
A nuisance, but we've handled it very well.
Okay, thank you. Are there any other questions? Okay,
Thank you, everyone. Oh, please.
Roth, one?
You have 4 vehicles. What's the average age of the other 3?
9 years, 8 years, 7 years, and 6 years.
Okay, so we're at the
Replaced
high
them.
end, which
Yeah.
is not good for you.
No, but we're trying to extend them as long as possible. That was
Oh,
something
and I
that
understand.
we've talked about for years. And that's just, we finally reached the point that
Yeah.
they're kind of like, now's the
And,
time.
and who do you send them to for service?
We've been working with over here in St. Charles, Suburban,
Okay.
and they've been very good with us.
Okay. Because there's
can't
been
speak for everybody.
discussions, I mean, KDOT,
Start that sentence again.
okay, there's been discussions in the past, KDOT has a major, you know, for the, and so does the sheriff, that economy, you know, if we can work an inter-department agreement, it may save us some money. And also then, you know, normal, they would track, are we getting the normal maintenance? And I think it's something we as a board need to look into and push because it could save us money.
Yeah.
I'm not saying it will, but
That's the thought. Thank you for that.
okay, you're welcome.
Okay. Any other questions? Okay, thank you.
Thank you.
And now, moving right along to Mr. Executive Director, Michael Isaacson. Good morning, Michael.
Good morning, everyone. Start with our resolution.
Yes, if we're going to start with the resolution, I'd like a motion and a second and to discuss and possibly pass a resolution authorizing the opioid response community implementation projects.
Judy
Second.
moves.
Tarver
Sanchez.
seconds.
Sanchez seconds. Thank you.
Great, thank you. So this is part of our overall effort to reduce overdoses in the community. I will highlight that we are really across the country starting to talk about overdoses and being less specific about opioids, just because opioids are still the primary thing that are causing overdoses and fatal overdoses. But there's a lot of other drugs of concern that we're also paying attention to. This is part of our ongoing effort to work with community partners to reduce overdoses. So we put out a request for applications and had a really good turnout from community partners. You can see in the therefore clause, the organizations that were selected through this competitive process, which include the Ecker Center, Association for Individual Development, Gateway Foundation, Lighthouse Recovery, Greater Family Health, Serenity House Counseling, and the Kane County Sheriff's Office. So this is just seeking authorization for us to be able to enter into agreements for us to contract with these folks to provide services in the community. And I will note, prior to this going to finance, we'll get the line item so we can do the line item transfer to the Sheriff's Department because it's handled a little bit differently. So it's within the county.
Do you have any questions?
I have one.
Yes, Mr.
Is this funded by the opioid lawsuit?
It is not. This one is actually funded by the state of Illinois.
Okay. Good enough. Thank you.
So yeah, this comes to us through a grant with the Illinois Department of Human Services.
Thank you.
Any other questions? Okay, please call the roll.
Juby? Juby, I. Tarver?
Tarver, yes.
Sanchez?
Sanchez, yes.
Strathman?
Yes.
Roth?
Roth, yes.
Okay, passes. Thank you. And moving along to resolution authorizing the amendment to the Illinois Children's Healthcare Foundation, enhancing children's mental health through family-run organizations grant. I need a motion and a second.
Sanchez moves.
Sanchez,
Judy seconds.
30 seconds. Thank you.
Great, thank you. We're trying to get the longest titles. I don't know what the record is, but we're working on it. So this is really simply looking at extending the term for this agreement. The way it was worded previously, and you'll notice we've worked in consultation with the state's attorney's office so that our now therefore clauses will now make it so that we don't have to come back for this kind of thing because it'll authorize the chairman to do more. But this is extending the time on this particular grant. And Mr. Tarver, I did see your email, and I think Mr. Tarver had requested more of an update for this program because this is a really exciting program. We have a lot of conversations going on, so I'm thinking maybe 1 or potentially 2 months, maybe more exciting to come and give an update, I think. So we'd love to do that and bring the parents in to be able to talk. But again, at a high level, this is something that has come from our Children's Mental Health System of Care grant, which is we're just winding down 7 years of that funding right now. This is additional money that this private foundation has invested in Kane County. And this has already been approved. This is simply extending it 6 months, I think. Is that right? Like 7 months.
What's a month among friends?
And we're actually trying to get a lot more money for this too. So that's why hopefully we'll have an exciting update. So
Okay, any questions? Ms. Juby?
I really love this grant for obvious reasons. But in your now therefore it be resolved, could you drop the bracket after grant?
Yes, thank you.
Good job on finding the money.
Yeah.
Drop the bracket. Thank you.
Any other questions or discussion? Okay, call the roll.
Doobie,
Doobie, aye.
Tarver,
Tarver, yes.
Sanchez,
Sanchez, yes.
Strathman,
Yes.
Rob.
Roth, yes.
Okay, it passes. Great. And now we're going to have the presentation of your budget.
Great, thank you. So just some baseline information about the health department budget. Again, typically we have always been asked in my career to be self-sufficient as much as possible. As the chairman mentioned, we do not get any funding from the general fund. There is a special public health levy that is just under $2 million that we get. As with many of our other colleagues, that amount has been flat for the past 15 years. So we get that flat amount of funding, and then we bear the responsibility of seeking additional outside funds or finding funds through fees for services that we provide. When funding goes down, we cut back on services. When funding goes up, we typically come and ask for permission to expand services. Blair, do you have my presentation? One second. Yeah. If you've got it handy, I can forward it to him too. Do you have it right there? Okay.
No presentation, no budget.
Yeah.
Oh,
That's what I heard.
I heard board members don't like presentations, and if I had less slides, it made me more budget.
I think if you took a poll, you wouldn't be surprised.
Thank you.
Motion denied.
I did send this to all the board members, so I apologize, Blair. And but I did want to send it to you with the caveats rather than just including it blank in the packet, because there are some anomalies this year that I think needed some context. So for this year, we are budgeting our opioid settlement funding, which we have not done in the past. So that's an additional $2 million that's showing up in our budget. We do have 3 sub-departments from the Office of Community Reinvestment that have moved over to the health department. So that's additional revenue and funding. Thank you, Blair. And also we have budgeted differently the way we are managing the ARPA funding. So there's some things that are truly are more expenses, but it's not simply that the health department budget is increasing. So I always like to start the 10 essential services of public health, and just the 10-second view on this. Really, you can see in the big letters around the outside of the 10 essential services here, assessment. We spend a lot of energy really looking to see what's happening in the community. What are the issues that are impacting people, whether it's infectious diseases, environmental hazards, or things like mental health, et cetera. We also work on policy development and program implementation. So you can see the 4 colored circles there from the orange down to the bottom. And then assurance, which includes that we're looking at access, which changes at the federal level right now. I'm in communication with our healthcare providers and our hospitals, just looking at what the overall impact on access is going to be there, making sure that we're supporting a strong workforce, being innovative and really focusing on how we can participate and add to the research base and the knowledge base for public health. And then just looking at overall public health infrastructure. And this is something that we really saw through COVID, how the system had not been supported over the years nationally. And then as a result of COVID, we've seen a tremendous outflow of professionals from public health, which is very challenging for us nationally. And then that's compounded by large reductions in force at the federal level, where a lot of the expertise that we have is not in the government sector anymore. So we have to make sure that we at the state and local level still have access to the information that's needed to be able to make informed decisions. Our vision for the health department is that every resident has the knowledge and access to opportunities to live their healthiest life possible. So I've gone over this before, but just want to focus on, we do want to make sure that people do have information to make good informed choices. And we do want to work as much as possible to assure that people do have access to, and it's not just access to healthcare, but access to healthy food, access to safe housing, all of the things that we know are predeterminants for health. Our values are listening, respecting, helping, improving, and excelling. I've gone over that in detail before. And then finally, our mission is to improve health outcomes. That's the primary thing. If we're not changing health outcomes, then what are we doing? That's ultimately what we need to be held accountable for. We do this by working in partnership with the community. We need to understand cultural, environmental, historical, and social factors that impact health. So really starting with who's in our community, what's important to them, why do they make the decisions they make, and how can we work together in partnership to increase the health of those folks, and then directing resources and services. That's primarily what we do. And, you know, unlike many health departments, we're a relatively small health department. We have about 100 employees, a little less than 100 employees. Lake County Health Department, for example, Lake County is 20 or 30% bigger than Kane County. We have 100 employees. They have 1,000 employees. They have doctors providing primary care, mental health treatment, et cetera. We have been we're a much younger health department, but we're a much smaller health department. So working together with folks in partnership is even more important. Just a few of the mandates that we list, and this is something that we put in with the budget every year. So you can see some of the state statutes. This is where we have our regulatory authority. In some cases, we are acting as an agent of the state, where this is where we do get our authority to be able to do things. We are the kind of the core for public health. We're making sure that we're controlling infectious diseases, assuring that we have safe food, assuring that sewage is taken care of, and other environmental issues. Those are really key things that we do at the state level. And actually, I'll be in Springfield meeting with the director of the Illinois Department of Public Health tomorrow. We're looking at different ways that we can enhance how local health departments work together with the state health department. So it's a pretty exciting process that we have going on there. Our org chart, again, is I always say we're very fortunate in Kane County to have such a really fantastic team of dedicated experts who are working on behalf of our residents. You can see that we're broken up. We have, besides our admin and finance side of things, we have 4 operational divisions that include everything from helping families who may be struggling with exposure to lead, which is a real threat to young children, investigating infectious diseases, working to make sure that our restaurants are conducting practices that minimize illness for the community, mental health, substance use, including vaping and tobacco, violence prevention, providing immunizations to the community, doing home visits. We just have a really wide ranging set of things that the great folks at the health department are out there doing every day to protect our residents. So all the names on this slide, this is why our health department is so strong. We are broken up into several different funds. So the opioid settlement fund, just a note on this again is where this is not completely controlled by the health department. This is a separate committee that's made up of myself as director of the health department, Chair Strathman as chair of the public health committee, the sheriff, the coroner, and the state's attorney. That 5-person panel makes determinations on how these opioid settlement funds are spent. This again is lawsuits with the pharmacies and drug manufacturers. The money keeps rolling in, which is good news. Actually, the state's attorney just sent me several emails with a couple $100,000 more that we got. We don't have a definitive amount that we're going to get over the next 15, 20 years because they're still negotiating different settlements, but that money does keep coming in. So that's very exciting. We have budgeted $2 million for projects for the next year. 350 is our primary public health fund. So this is where the vast majority of our core public health projects have gone. Fund 351 is about $600,000, $700,000. That is Cane Cares. So this is our home visiting program. This is something that for the past 25 years that the county board has been a very strong proponent of. And this is why it got its own fund once upon a time when we started this program. But this is a nurse run home visiting program. It gets excellent outcomes and is really exciting. I've mentioned in the past, we've just expanded the home visiting program. Used to be for first-time moms, but now we're able to expand at the national level with the program that we use, or the model we use is called Nurse Family Partnership. And we're able to expand now to do not just first-time moms, which is really exciting. We'll be able to serve even more people. Fund 355 is the ARPA funds that were allocated to the health department to focus on behavioral health. So we've talked about that in the past, and we'll be providing more updates on that shortly as well. Fund 404, 409, and 414 are the three new programs that have come over from the Office of Community Reinvestment. This is a little under $1 million with these programs that have come over to the health department now. So just looking at our revenue and just to orient you to the slide, we have two primary columns, 2025 and 2026. So you can see not only what the change is from year to year, but also there's a sub column there under each year that shows what percentage of our revenue comes from each area. So you can see property taxes are relatively flat. We're hoping to see an increase for licenses and permits. Grants, we're looking to see an increase, even though we have seen some cuts this year. We did have a $1 million grant that was X'd out at the federal level. There's still ongoing lawsuits between the states and the federal government around that. But as a result of us being notified that funding was cut, we eliminated 5 positions. So we worked with the Human Resources Department. We were able to move people into vacant positions. So fortunately, no one lost their job, but we did lose those positions. Charges for services, reimbursements, interest, fund balance utilization. Just a quick note on fund balance utilization. We do have some one-time things that we're looking at. So we're looking at expanding and improving how we're able to provide all of our programs through procuring a new electronic health record. So we've been working with the purchasing department, and thanks to Laura and all of the directors, we're in the process now of reviewing all of those applications. We also are looking at upgrading our environmental health software because we do have a system that's still much too paper-based for 2025, and it's really absurd to talk about. So we've gone out through purchasing for a competitive bidding process there, and the team's evaluating those. We are looking at, and probably next month, I'm guessing, we'll come with more information about the Elgin renovation, so we can move forward with that. And then we have some grants that were prepaid. So for example, we have a $350,000 grant from the state where they already paid us in a previous fiscal year. So that revenue now is in our fund balance. So it's grant funding, but it's being counted as fund balance utilization. And then some of the opioid money is also, because we already have it, is technically fund balance utilization. So that's what we have on the revenue side. And then on the expense side, you can see we are largely just like a lot of the county, we're largely personnel costs. So that's where a big chunk of it comes. You'll see, again, the tremendous increase in contractual services, but that majorly has to do with us adding in the opioid funding, the ARPA funding, and the new projects that we have with OCR. Just shows you what the balance is: 53% payroll expenses, 31% contractual services. But again, that's more of an anomaly this year, I would say, just with moving those other items in. And then we've tried to include some of the capital expenses that we're going to be seeing with Elgin. With that, I'm happy to answer any questions.
Do we have any questions? Yes, Mr. Roth?
Roth here. Can we go back? You were talking about the different funds. And I had some questions on the opioid.
On revenue?
Where you broke out the, all the different funds, 305, et cetera. that
Yep.
page.
Oh, yeah.
Okay. You mentioned the opioid that it's, it's going to public health, sheriff, and state's attorney, I think. Is there a set percentage of each, or is it changing as we go?
It's that those 5 people, including the chairman and myself,
Right.
make the funding decisions.
Yeah.
So that's not where the money is being allocated necessarily.
Okay.
That's just the body where we're making those decisions.
Yeah. I'm asking more, are we going to be consistent? Because if it goes up and down, it's kind of hard to use it. And then the other is, are there any restrictions similar to, we had a whole bunch of ARPA restrictions? Do we have to spend it by a certain time? And
Yeah, I do have to report all of the revenue we get and all of the spending. I do have to report to the state.
okay.
And there is a document that outlays how we need to spend the funds.
Okay.
So, which I'm happy to share. It's just a
And
couple
it's more the
pages.
question, are we able to build up a little surplus so we can use it going forward to meet expenses and not necessarily spend it all this year? That
Right.
was,
Well, and it will be ongoing as well.
no,
because
right.
it's-
We're getting more in and stuff. It'd be nice if we could get some common,
It's fluctuating, so
I know it will fluctuate. Yeah,
Yeah,
that's a
so-
reality.
we'll be fluctuating with
Yeah.
it somewhat.
But hopefully we don't have to spend it. Oh, we got to spend it by the end of the month type of.
No.
Okay.
No, we have flexibility.
Yeah.
Right.
Okay. Good enough. Thank you.
Any other questions, comments?
And one thing I should note too, that I skipped over on our expenses, the kind of the third row there with total head count. Last year, we had budgeted for 125 employees, and we were looking at a pretty aggressive expansion in different areas. With what's happening at the federal level, we've come in much more conservatively this year. So I think we took the $1 million hit already. We're a $14 million budget, so $1 million hit is pretty sizable. But just looking at how funding is being impacted across not only potentially state funding, federal funding, private foundation funding, all of these things are interconnected. So we're coming in more conservatively for this year and have reduced our head count pretty significantly.
Okay. Okay, thank you very much. Very informative. Thank you for both for those good reports. Okay, moving right along. Do we have any old business? Anybody online? Okay. Any new business? Okay. Okay, I guess the new business would be I flipped to the wrong page. Sorry. We don't have any new business. We don't need an executive session. And I would like a motion to place the reports on file.
Sanchez asked for unanimous consent to place the reports on file.
Okay, thank you, Mr. Sanchez. Okay, and a motion and a second for adjournment.
Roth will make a motion to adjourn.
Second,